Welcome back to Champions of Care. We're talking about end-of-life options, including hospice and palliative care. And I'm so pleased to have with me in the studio today Dr. Evan Fonger. He's the medical director at Hospice of Michigan, one of the best-known, largest, and most experienced hospice providers in the state of Michigan. Dr. Fonger, welcome to Champions of Care.
It's great to be here. Thanks a lot.
Now, you're a family practice physician, and you've been fellowship trained in hospice and palliative care. Is that correct?
That is correct.
Tell us a little bit more about hospice. What services are part of hospice care?
So hospice is a movement from the 1970s where it was realized that end-of-life care in the United States was not what we wanted it to be. So the hospice benefit was developed by Medicare for people with a life expectancy of 6 months or less to receive what's called interdisciplinary team services for comprehensive care at the end of life. This includes physician services, nursing services, social work services, spiritual care services, aid services, volunteers, and many other services that people need and want at the end of life.
How does a patient get started with hospice care? Is it something that their physician has to call for?
Well, ideally, a physician would be in favor of hospice services being delivered for a patient, but anyone, including you or I, could call a hospice referral for any other person. People can do self-referrals, family members can do referrals, or physicians can do referrals, or any other part of the medical team.
How would a person know that they are within that six months of life period of time to have the wherewithal to pick up the phone and call you?
Well, we have some guidelines about patient issues that start to come up that give us a hint that prognosis is in that 6-month time frame. Ideally, you would ask your doctor and say, am I eligible for these services? Anybody who is interested in those services can just give us a call, however, and we can evaluate them and see if they're eligible for the services. And that's the easiest way to start the process to try to get involved.
Now, I usually think of hospice care as being something that happens in your home. How and when might a person receive hospice care inside a hospital?
Mm-hmm. So the good news about hospice is that it's not a place. So hospice can be delivered in any setting. I take care of people in their home, in an assisted living facility, in a nursing home, and also in the hospital. Here at Oakwood, we have recently started a program in a 6-bed unit where we have inpatient services for hospice care, which is very innovative and not normal for a hospital system to provide. And usually that occurs while you're in the hospital for another reason, and a practitioner recognizes that you might benefit from these services.
You know, Oakwood Healthcare and Hospice of Michigan are indeed partnering on this. It's the first inpatient hospice unit in a long time, maybe forever, for Hospice of Michigan, so we're very proud of it. Mm-hmm. And we wanted to show our viewers. So our Champions of Care video team took a road trip to the hospice unit, and we want to play it now. Let's take a look.
Terrific.
My grandma was a hardworking, caring, loving person. She always made sure that everyone else was taken care of before herself. Everything was always upbeat to my grandma, and she was just so happy to talk to her family. She absolutely loved her family. We learned about the hospice when my grandma had her stroke. You know, it just wasn't looking good, and we made a family decision. You know, this is not how my grandma would want to live. And we said, you know, we've gotten such great care from the ICU unit downstairs that we didn't want to leave Oakwood. We didn't want to leave Annapolis Hospital. And so the doctor said, well, you know what, let me get back with you. And he came back and he said, we have a new hospice unit. They are going to go ahead and accept you up in the room.
Hospice is a specialized care for people who have life-limiting conditions. It focuses on helping people achieve the greatest quality and comfort during their lifetime, however long that is.
We went out in the community and looked at other hospice areas to see what they looked like. So we wanted it to be a more home environment for patients and their families. So we tried to pick soothing colors for the paint for the walls, and then some home-like furnishings instead of all just hospital furnishings.
They gave my grandma exceptional care, and us as well. I mean, we were provided beds, we were provided linens.
As a nurse, the goal is to help the patient and their families go through the end of life with, basically to die with dignity and respect, to meet the comfort needs of the patient, for pain control, symptom management, nausea and vomiting control, but then to include that spiritual and emotional support for both the patient and the families.
The relationship between Oakwood Annapolis and Hospice of Michigan is a relatively unique relationship. There are not too many hospital-based units that partner with a community-based hospice. Very often the hospital itself may have a hospice. Oakwood has chosen a community-based hospice partner that has excellence in providing end-of-life care, but also shares the mission, vision, and philosophy of Oakwood. So I think that's a really nice combination.
I don't think Oakwood could do any better than what they've done. They helped our family deal with the most difficult time, a most intimate time in our life, and what they did for us gave us the peace that our grandma was taken care of. We've all walked away with knowing that we made the best decision for her, and that Oakwood made the best decision for her.
Dr. Fonger, how would you define a good death?
Well, I think from the data we have from patients that there's a few things that run as themes for a good death. Most people, when you'd ask them, want to die at home. They want to die with their people that they care about the most around them. And they want to have their last days without medical problems or symptoms related to their life-limiting illness.
So no pain?
Yes, yes. So the things that hospice provides that meet those goals are hopefully good symptom management, good communication with family members and team members to make sure that all the wishes of the patient are taken care of in the final days of life.
And what has been your early experience with the inpatient hospice unit at Oakwood Annapolis Hospital? Does it indeed feel like home?
It feels as close to a hospital as a hospital can to be home. It has 24/7 visitation for as many family members as are available. It has wonderful caring Oakwood staff, and it has an environment that doesn't feel like a hospital. It feels like you are the only one there.
So you have the comforts of home with the care of skilled hospital staff. If you feel, maybe as I would, that I might not be able to do everything for my loved one in those final hours, and I need a professional around.
That's right, and our goal is to make it so that in a short period of time we get the things in place on that unit with medications and all the needs delivered for the family to either spend those last days in a comfortable environment or plan for the next stage of their life with hospice care in whatever setting they'd like to be.
Dr. Fonger, thank you so much for giving us a glimpse into this world that we sometimes don't want to think about, but it sure helps to think about it in advance. Thank you for being with us.
It was my pleasure. Thank you.
I also want to thank Dr. Christopher Williams and Don Johnson, who taught us so much about hospice care, palliative care, and advanced directives. For more information about any of these topics, please go to oakwood.org or give us a call at 1-800-543-WELL. Thank you so much for being with us today on Champions of Care, and we'll see you next time.